it's an example of that if you've seen it.
I kind of start this one, actually. I just want to take a story of my mom. My mom has a high blood pressure. She cannot go to Egypt or to the West Bank for medical treatment. And she is dying very slowly. And this is not her. She is not the only one. We have women with breast cancer. They died because they couldn't have chemotherapy in Egypt. In Egypt, to go through the Rafah crossing to Egypt, or all to go through the Erez crossing, which Erez crossing is between the West Bank and Gaza. So they couldn't go even to the West Bank or to Jerusalem. We have right now 221 amputated, dismembered, injured folks. They cannot go to medical institution inside historic Palestine. So I mean, I can mention a lot of numbers. Actually, the antidepressant, like in psychosis, schizophrenia, schizoaffective disorder, and all of these issues, it is lacking in Gaza right now. Most of the people are using tramadol. Tramadol is like a drug that can help people to relax and to have some ecstasy. But this is not recommended by doctors. They are not recommended by physicians. It is like drug-induced medication. Like it is not like really like recognized or authorized by physicians. So I mean, it is very clear. Like if you live in Gaza, I mean, I work with partners like Legia Center. We are at Grassroots International. We work with Legia Center. We work. I think Dr. Osama mentioned Physician for Human Rights, Aaron. And we worked with them like in the last 5 months as part of our grantee for this year. But also, I mean, I can speak later on organizational connection between the West Bank and Gaza and how it is hard to. But I think it is important to mention the access is really like in a nutshell. I think Gaza is a combination of wars to get to and concentration camp right now, and you can think about it and come with a lot of stories and examples about it.
Yeah, I mean, I think, the link between the two is so strong historically. They're both settler colonial states. I mean, the US was founded on genocide of the indigenous native population and then became the richest and most powerful country in the world by kidnapping and enslaving human beings from the west coast of Africa and then using that as its engine of become an economic powerhouse. So this is the society in which then this healthcare system developed, right? As Osama was talking before in the US, right? So you have two societies that have settler colonial logic, the logic of elimination. And then it's no surprise that the healthcare systems are built in a way that is racially supremacist at its core, right? And also built in with capitalism. It's also ways to make money. The US health system is designed primarily to make people really wealthy. So in that sense, then the populations that have been historically marginalized, brutalized over time, it was not built for them. And the whole system is set up now in the neoliberal era to sort of utilize language of sort of color blindness to then perpetuate and continue this inferior care, inferior access for people of color, right, in the US, right? So the entire system is really designed to keep people who are already healthy and wealthy in those situations. And there's so many specific details we could get into, but in that same way, you see how as was just being discussed, that 40% of Gazan permit are turned down, right, or delayed so much that people can't get their appointments. 20% in the West Bank, right? Out of those people applying for permits out of Gaza, 60% of them are either children or people with cancer. And we know that the people with cancer who get their permits denied have over a 50% higher risk of dying than people who are able to get through and get care in either East Jerusalem or Israel, Jordan, or wherever. So you have this, I mean, speaking of weaponization is the perfect word. It's basically just, we're going to decide when and how far this gate is going to open. And if we want, we will let you die. That's what's called necropolitics, in the words of Achille Mbembe, post-colonial theorist.
Yeah, and I think what, thank you, that's brilliant, Bram. And I think what we can see also in both settler colonies is a regime of disposability, right? Where some people are just seen as, like in the biopolitical sense of the way, disposable. And that, you know, there are different ways how to eliminate and how to terminate a population. You don't need to genocide them and kill them per se. You can just, you know, create a very harsh living condition for them, exploit them, so on, and then leave nature do its thing. And we saw a lot of writings on that after Hurricane, after Katrina in the US, where the vast majority of people killed were Black and poor, and after every catastrophe. So it is no surprise that the living condition of Black Americans or Native Americans, or, you know, after we can see that happening now with COVID or after H1N1, their living conditions and their bodies also have been diseased more by their historical trauma, by their alienation from the land, and so on. And then they're more disposable to that disease and mortality. In Israel, it's quite the same, and especially in post-industrial societies, right? So when now you don't really need that huge amount of laborers, right? Industry is overseas. You don't need people in the mines. You don't need people in the factories. It's a society built on services. So people who are not, you know, are from the wrong race and are not, don't have a big consumption ability, and you can, Palestinians often have been used as construction workers, you know, or just, you know, washing dishes in the restaurants and so on. But now when you need them less and less, they're simply disposable, and you can just, you know, leave them to die from this or that. And we need to remember that people die slowly and every day without that spectacular number, right? It's a slow death, as Yad has mentioned, you know, people who die prematurely from unbalanced hypertension or diabetes or untreated cancer, but also from bombing, right? And the Palestinians are a laboratory for military weapons and for surveillance tactics that are then used to, are again capitalized and sold overseas to make more profit, and you know, test proven by, you know, by on Palestinian bodies. So you slide into a new era of necropolitics, biopolitics, and disposability, where these places like Gaza or the West Bank simply become dumping ground, right, for refugees. In the words of Bauman about fluid modernity, just dumping grounds. And I think it's the same in the US for a lot of the reservations of the Native Americans, or the ghettos or the slums, where people, you know, at the end of the day also these becomes pockets of crime, of racialized poverty, where people also become violent toward each other and might have high rates of crime among each other, which a lot of it what we are facing with the Palestinian community inside Israel. So yes, there are different parallels. I think also in different settler colonies, you know, Canada tries to portray itself as a progressive country, but it is again a settler colony with a very high, you know, rate of also disease and mortality for the indigenous population, Australia, New Zealand. So these are all, we can draw parallel lines to these examples.
Thank you very much for everybody's input. I think we're going to move on to the next big chunk, which is going to focus on mental health and various factors that contribute to it: incarceration, mortality rate, state-sanctioned violence. And I forgot to mention this at the beginning of the event, but if anyone who is attending has any questions, please feel free to put them in the chat, and me or Fatima or Brooke, we will say them out loud, or there will be time at the end of the event for everybody to ask questions out loud. So yeah, so Brooke, do you want to start off with the first question for mental health?
Yeah, definitely. So we're gonna put this off to Ayman first. So the question is, what is a mental health issue that is most prominent among Palestinians, and how does access to mental health resources play a role in these issues?
Thank you, Brooke. So the most prevalent actually diagnosis like in Gaza right now, and actually mostly in Palestine, is ongoing trauma, not PTSD. PTSD is the one that is like used in Western psychology and Eurocentric psychology to mention like and to speak about PTSD, post-traumatic stress disorder, is usually it comes from 4 to 6 months after the unexpected traumatic event. So in Gaza, we are dealing actually, and mostly in the West Bank, as Dr. Osama or Bram, I'm not sure if I remember, that every area has its own cultural frame of reference, has its own way of thinking, has its own cultural overview. So, and this is part of the collective trauma, historical trauma that started in 1948, that Israeli created what we call it cultural compartmentalization. So if you are from the West Bank, you cannot go to Gaza Strip. And if you are from Gaza Strip, you cannot go to the West Bank and vice versa. Like for instance, just personal story, I have never been in the West Bank in all of my entire life. I am 36 years old. I cannot be there. So and also the educational curriculum, and this is very important into understanding the cultural frame of reference before we delve deeper into that. The West Bank, actually, they tend to take the Jordanian curriculum. And in Gaza, they tend to take the Egyptian curriculum. And inside Israel will be, of course, there will be the Israeli curriculum. So it had Israeli created a different educational lenses in understanding the current situation. And that was beginning from 1948, and that was what we call it cultural compartmentalization between the nation, the indigenous people. We can draw parallel between the ideology of the Great Manifest Destiny ideology here in the United States, and also with the Zionist regime, with the Zionist project or the Zionist settler colonial project, when it was the end game was about the chosenness complex. The end game was about taking more land, kicking the native out of their land, as he had greatly mentioned. About 800,000 people were kicked or forced from their land, and 532 villages were completely destroyed, and 1 million refugees were expelled from their lands. So to come to, I just want to give the framework before I go. So the ongoing trauma, we are dealing with ongoing trauma because even Israel or the settler colonial project doesn't give us time for healing. So if you look at from 1948, but let's talk about the recent time, from 2008, 2012, 2014. As you can see, a system of 2 years. You can't heal trauma in a generation where 91% of the kids in Gaza that are suffering from complex, compound, ongoing trauma. You can't deal with the clinical depression or clinical depression that comes out of situational depression that usually takes 6 months. Someone, chemical imbalances that leads to clinical depression. There are so many cases of suicidal ideation in Gaza, and it is very hard to pinpoint the kind of diagnosis, because for different reasons. There is a stigma when it comes to mental illness. I know here in the United States, because I worked with refugee mental health, that there's a huge stigma related to mental illness. But in Gaza, it is really very deep rooted. And actually it is, like here in the United States, you can use the word therapy. We use their group recreational, grouping or group healing. We cannot use therapy because therapy it can signify a stigma in mental health. So ongoing trauma, situational and clinical depression, and also suicidal ideation is very high right now in Gaza. And I think if you are familiar with the news right now, there are a lot of people who literally burn themselves up. In the streets, because the situation is very hard. The unemployment rate is 54% in Gaza. When you talk about the 4 hours of electricity every day, when you talk even you can't go to the West Bank, you can go to Egypt and also the current explosions every day, the sense of hopeless, helpless situation that people are feeling. That's why it led to that increase of mental health cases. So I can talk about healing methods that we are using, but I think there is a question for that. So I can stop here and will be happy to answer any question later on.
Yeah, thank you so much for that great opening. Could you elaborate on maybe like the disparity that is present between the state of mental health in Palestine versus what it looks like in Israel? You mentioned the thing about like 91% of children in Palestine being affected by trauma. What do those statistics maybe look like in Israel? And I guess what are factors that you see contributing to this disparity?
I honestly don't have the correct statistics coming from inside Israel, but I think this is like, you can see Israel is in the news. They said we have a lot of traumatized kids on the border with Gaza. And I think this one, like if you can compare it to the drones hovering every minute in Gaza, like, and how much it can affect the kids, if you can compare it with every child in Palestine actually experience more than four traumatic experiences in his life. If it is not healed, can lead to mental health disorders. So I mean, I also, it comes actually down to secular colonial project when it comes to disparity. I mean, disparity is in everything in Palestine. I mean, at least there they can go to psychiatric hospital. They have medication. They have antidepressants. Like when we talk about mental health, we talk about objectivity, about a case, about a human being. It's not like about like political issues. But I think this is a question maybe Dr. Osama, if he has like statistics about it. I really don't have like a clear statistics or like research-based statistics about that.
Yeah, well, you know, as Ayman said, generally, yes, most of the publications and talk about trauma in the Israeli society is either in about soldiers coming back after their military service in the West Bank, Gaza, or Lebanon, traumatized, and then that whole discussion of post-trauma, which is similar to what you might have about soldiers in the U.S. coming from the war zones, and of people living in the area near Gaza. And where there it's seen as an ongoing trauma and resilience to the attacks of from Gaza. But overall, I would say yes, that there is a general quite a rich system of support, also of medication, but also of therapy. Yeah, but I'm not an expert in on trauma or mental health. So.
Yeah, so also kind of following up on what we were speaking about before, when we talk about trauma on the Palestinians, how do they heal? Like, what does healing look like for them?
This is really a great question. I was waiting for it because, like usually, I speak about what's going on, like in Gaza, in terms of trauma. Yeah, I think in terms of healing. I mean, I honestly I did like the project Let the Children Play and Hear back in 2005 in Gaza, and I think it was very successful, like because we came up with indigenous way of thinking how we can heal our kids when they come to us. So just very briefly, so very simple, like I will start with the kids and then we will go to the adults. With the kids, we usually do recreational like healing, like a dabka. Dabka is a full court dance where we go to the school, to United Nations Relief and Work Agency, and we also like that we have some volunteers, and they do dabka and they do cultural dance, and it has two end games. It has for resilience and to stick to their own culture, to their own heritage, and the second one actually is writing therapy. And we ask the kids to write, to give them a sheet of paper and a pencil, and ask them what's in your mind without dictating them. And we found that really they are so brilliant. They are really like, I mean, I have some people from the Boston College. They came and they said, wow, this is really great. The second one, which is a drawing, I don't use the word therapy, but a drawing techniques. So drawing, we give them a sheet of paper and a pencil, very simple actually. And usually the kids, this is like inside, as you know, the kids are like sponges, like they are like touchy-feely. They usually draw the missiles and rockets with the Israeli flag and the US flags. And surprisingly enough, I went to the Palestine Museum in Connecticut, and I saw the pictures. And I was with a psychiatric professor, said, oh, these are the pictures that those kids did it in Gaza. And right now it is a great advocacy I mean, this is a different subject, but I mean, this is, I think, the indigenous one. So coming back into Eurocentric psychology, I think some people like, I think we can adapt Eurocentric psychology. I know PTSD doesn't fit the Palestine context because of different mechanism, different thinking about it. But I think there are so many diagnoses in mental health, especially in the DSM-5 diagnostic and statistical of mental health, like number 5. So I think the idea here is just how to use it and how to adapt it to be culturally sensitive and contextually appropriate. And this is actually the hardest one. Personally, like I believe, like personal liberation psychology, where like the indigenous people come up with their own treatment, with their healing. I have a personal story when I was working with Doctors of the World of Spain, when we were doing like a project mitigating a stigma related to mental illness. I found that you have to listen to the locals to tell you about the cultural differences. Not you come from the United States or come from like Spain, and because you are the program manager and you have to please the funders. And it is very counterproductive, honestly. Like I can give like hundreds of examples how it is counterproductive. That's why there are so many healings. I just want to give me 2 minutes about the healing. I think the healing like in general, not just in Gaza and Palestine, I believe it should come from socially, from restorative justice, retributive justice, and also reforming Zionism, if not dismantling Zionism, as a settler colonial project, as a great manifest destiny ideology, and the doctrine of discovery in the United States. So the second one, I think some people talk about reconciliation committee, like some books mention that how you guys, like, you have to have a reconciliation committee as TRC, as a Truth and Reconciliation Committee in South Africa. I think there is difference here because we are dealing with interstate conflict. Is different than intrastate conflict. Like not people inside the area. Like for instance, I haven't seen an Israeli all of my entire life. So how can I reconcile with someone I couldn't see? And this is like very simple premise about like about that. So the last one, actually, we are dealing actually. This is like, and this is coming from liberation psychology. Uh, we are dealing with a settler colonial project. It is not even a conflict. It is not between two equal sides. We are the oppressed. We have nothing, but we have the moral power. But they have everything. So when it comes to liberation psychology, without going into politics, it is really, you can't fit like even the healing in general. So many, and also very importantly, I think in terms of liberation psychology, we have to think if there is any solution for the liberation of Palestine, and I believe it will be soon, there should be understanding, a major understanding of thinking about Holocaust trauma, and when it comes the Jewish trauma, and when it comes to Nakba trauma, and in order to move forward, we have to think about this kind of unhealing, of unfinished business when it comes to trauma, because this is like the kind of victimhood that caused us to suffer as Palestinian, as we are the perpetrators of the Holocaust. And we have to be honest and frank about these issues in order to achieve a real framework in liberation psychology, or in real trauma healing, because this is like the instigators until now. As you can see, guys, the anti-Semitism comes up, even it is linguistic concept. Yeah, thank you so much. I will be happy to answer any question again.
Thank you. That was very, very thorough. Thank you so much. And then could you briefly discuss how COVID-19 has recently affected both mental health and mental health services in occupied Palestine?
Yeah, I want to speak based on one of our partners, Gaza Community Mental Health Programs. They're our partners in Palestine. So I will speak what they wrote to me, like, so I can give them some credit to that. Yeah, I think COVID-19, it was very hard to reach out to mental health clients in some marginalized areas. So that was awareness raising and giving them some, some incentives right now, especially people with, those people who their legs had been amputated or like dismembered. So there has been awareness outreach to those folks that they couldn't be reached out in other medium. So yes, it affected like in mental health. I was speaking like even with Aaron, with Physician for Human Rights, and how it is can affect even the mental health, like in Gaza and the West Bank. And like it is mostly awareness raising to some communities. Like I'm speaking about mental health here, not about medical issues, because I have no experience in that. But it has been a lot of connection, a lot of awareness raising when it comes to mental health in both Gaza and the West Bank, and also inside Palestine. Also with our partner Baladna in 1948, there has been also a very concerted effort to reach out to some of the Arab citizens inside future Palestine. And so it was mostly awareness raising. And this is in Gaza, it's really hard because like if someone has schizophrenia, psychosis, or schizoaffective disorders, you need some kind of like, approach to reach out to some folks. Yeah.
Okay, thank you so much. We're going to move on to the next, the last part of the event, which will discuss general health issues, respiratory health, GI health, children's health, and with Dr. Tanous's experience as a clinician in Palestine and working with children's health as a pediatrician, we thought he should start off this topic of discussion. So Dr. Tanous, could you describe how has Palestinian children's health been affected by the occupation, and what is the biggest challenge that children's health faces in Palestine?
Okay, yeah. Can I start with a bit of elaboration on the previous topic of mental health and healing in that sense?
Yeah, of course.
Yeah, thank you, Ayman, for the very, profound talk. But I think, we need to recognize that, we are in a very bad period, I would say, of our history as Palestinians. Maybe generally in the world, everything is becoming more violent and militarized and so on. But from my many talks to Palestinian doctors and the population in general, also and I have the ability to travel between the West Bank, Gaza, and inside Israel. Even in some of our darkest hours of massacres, in Sabra or Shatila, or massacres in Lebanon, and the Israeli invasion and the bombing of Palestinian refugee camps in the 80s in Lebanon, and so on. As long as there was still a form of resistance to the occupation and a part of a global third world fight for decolonization, for the health of, for the independence of the people of the global south in general, right? That was the mode in the 60s and the 70s and to a bit of the 80s, and you still had a kind of a functioning PLO, Palestinian Liberation Organization, that had a dream, a vision of return, of decolonizing, of fighting occupation and so on. That it truly affects the well-being of people, and it does create a kind of hope for a better future, that yes, we are suffering, but all of this suffering might in the end will lead us to a better future, to our homeland and so on. Then after the 90s, and after the end of the Cold War, and the US being the only mega player on the global scene, and then the Oslo agreements, the negotiation between Israel and the PLO, and later on the recognition of Israel and the return of some of the Palestinians, Palestinians got quote unquote a land to live in, and but of course this has led to the creation of the PA, the Palestinian Authority, that does not have any authority to the legitimization of the occupation, to the increase in settlement building and so on, but all under the envelope of the peace process. So, and that had completely aborted any defiance or any resistance to the colonial projects. So now, and it has created another player, the Palestinian Authority, which is a kind of subcontractor to the occupation, right? It does not fight the occupation. It does not want to decolonize. It kind of makes profit and makes some kind of, you have a creation of a business class, of an elite that makes a good living out of it and so on. So this leads to, has led to a huge amount of frustration, because now it's not simple. It's not black and white as if, like the Intifada. You have the Palestinians and you have Israel as an occupation forces. No, you have also the PA that is also suppressing Palestinians who are trying to liberate. You have also another corrupt government that does not care and suppresses its own people and so on. And you do not have an attempt generally, any political party or movement or so on that does have a decolonial agenda, and there's also no negotiation and anything. So it really looks like there is no national projects, right? And a lot of the leaders or potential leaders are in prison or have been killed and assassinated, and the population has been fragmented. So it is an overall, feeling of dystopia with no active a player to push it forward, and that truly affects the mental health and the hope for a brighter future that truly blocks, and that of course is related to the general mode of depression that we are seeing all over, right? So I don't think healing is anyway nearby or accessible or easy and so on. Just you become over flooded by death and by catastrophes and by visions of war, so you kind of become comfortably numb in a way. But I wouldn't say healing. There is no collective project of decolonization. Yes. So regarding the general health, so as Bram started with talking about settler colonialism, we know that settler colonialism as a process that tries to change the population, to change one kind, to eliminate the native and to bring another population of settlers to become with sovereignty, right? It tries to create a form of sovereignty that correlates to everything. It changes. It expels the vast majority of the population, but those who remain. So if we look at Palestinians who remain inside what is now called Israel, or in the West Bank and Gaza, who has become refugees, and later on, also their life has completely been changed. They have been alienated from the land. They have been alienated from farming, from their natural food, from their natural habitat. They are no longer farmers or any kind of jobs, and the cities have been completely evacuated. So you don't have an urban class, you don't have a farmer class, and that completely distorts a society. And if we look at the entire eco-social theory of Nancy Krieger, where there's a big description of how these processes of historical trauma, deprivation of economic, people are pushed to the bottom of the economical ladder, so they become poor and they don't have the ability to accumulate capital with generation, and then they are exposed to racism, and then they are exposed to ongoing trauma and to toxins and hazardous, and don't have access to appropriate medical care. And the historical trauma is transgenerational. And what else? Yeah, and you have alienation from the land and a change of the entire ecosystem, and that in the end leads to a change in overall health status of the people. So you can see a lot more obesity and hypertension, and more reckless behavior, whether it's smoking and COPD. And people, so if we look at the Palestinians, whether in 48, but also in Gaza and so on, their living habitat habitat is completely uninhabitable and completely unhealthy also for a normal life. You cannot imagine really a place where you can go out at night or after work and do sport and big parks or walking areas and so on. So that truly affects your whole life. So if we look, for example, inside Israel at the gap between the Jewish Israelis and the Palestinian, we can see that for all the reasons, for Palestinians die way more also for, of course, hypertension, diabetes, cancer, cardiovascular diseases, COPD, and lung diseases, infections, car accidents, homicide also. So you become entrapped in your own ghetto communities that become poor, unemployed, and eventually violent, right? And there is no police control, and car accidents. So for all the different reasons of mortality, the Palestinians die much more. The only reason we die less of is suicide, actually. So we commit less suicides than the Israelis. So we can see that overall changes the health of the entire population. So in terms of children, of course, because children don't have playgrounds, the Palestinian communities do not have in Israel, we are 20% of the population, but we live on 3% of the land. And this 3% of the land is just, packed concrete buildings on top of each other, only residential areas that are very crowded, with no parks or open spaces and so on. So people, play in the streets, right? Kids, they don't have designated playgrounds, and so of course you have more car accidents, even that, from an early age, home accidents, more obesity, more diabetes, and so on. So if we look at literally every aspect of life, is modified by colonialism. Colonialism really changes you. And the same would be for the West Bank and Gaza, and Bram here has written a nice article in the London Review of Books, right, about the higher percentage of obesity and diabetes in the West Bank, because also if you live in a refugee camp, you're not a farmer anymore, and the products what you eat is not fresh fruits and vegetables. So from a very early age, you become and with changes in markets and with commodities and products in the supermarket, you eat more basically trash, right, and processed food and so on, and become fatter with no place to do sport. So in that sense, colonialism completely changes your health and your ability to change your health status. So that, and another remark I want to say, whenever we talk, especially for people outside of the region, about the West Bank and Gaza and Israel and so on, people often think that these are, given geographical units or kind of states or so on. It's not. We need to understand that all of that during the British Mandate until 48 was historical Palestine, and these are artificial borders. There is no such thing as the Gaza Strip before. It did not exist. Israel created it. It is an artificially created piece of land that the frontiers of that is the colonial expansion of the colonial expansion of Israel, right? So Israel expanded until that part, and then it created the Gaza Strip in order to be a dumping ground for refugees, right? And the same for the West Bank. So these are not artificial units, and if we want to imagine a better future, we can truly imagine a future where these units do not exist, where you can have one state that is, democratic for all its citizens, secular, and so on, with a redistribution of health, rather than trying to empower or to donate to Gaza or to make living under these enclaves, racialized enclaves, better or more sustainable, or so on.
Thank you so much for that response, Dr. Tanous. And then, Brooke, do you want to ask the next question?
Yeah, definitely. So how has the occupation suppressed Palestinians' ability to prevent and fight COVID-19? Also, how are preventative measures and COVID-19 treatments available to Palestinians?
And these questions are open to everybody as well, so.
Okay, so I will start from the beginning. So first of all, we need to understand that Israel controls basically the entire spatial area of of West Bank and Gaza and so on. So the minute the first COVID cases were discovered in Bethlehem, there were tourists from Greek, Israel completely shut down the entire city and blockaded it. And it was really a deja vu of military raids. And then we can see that the same did not happen when settlements had COVID, right? So Israelis have the ability to completely shut down the place itself. And then you can really see that how much dependent are, the West Bank and Gaza have no access to the outside world without the permission of Israel. So everything, including the testing kits, the ventilation, the materials, everything had to come through Israel, through the approval of Israel, right? And here you can see a huge amount of dependency. And in times of stress and dependency, this really creates hierarchies of who has the ability to give what to whom. So in that sense, I would say that the conditions that most Palestinians arrive to the COVID, having a healthcare system that is on its knees from years of deprivation, of siege in Gaza. You literally have an ongoing siege where there is often, you have electricity of only a few hours a day. You don't have any equipment coming in, and so on. So on top of that very fragile healthcare system, COVID came, and then you don't have the ability even to export freely what you want, right? So of course it was heavily affected. That's why the Palestinians were very careful in doing their own, social distancing and shutting down everything, because they know that we cannot afford to have a catastrophe. Our healthcare system still will simply collapse. It does not have ICU beds as needed, doesn't have ventilation, and so on. So from the beginning, I can say everything has been controlled. And then, the Israeli violence continued all along the way. So also military raids, the raiding of houses, house demolition continued while COVID is there to literally leave people homeless, right? And we can see that Jerusalem, for example, is a very interesting case to study, because East Jerusalem is occupied in 67 area, like the rest of the West Bank, but it has a special status. So they are residents of Israel, but not citizens of Israel, and they should receive healthcare from the Israelis. So the Israelis actually like the red shield of David, Magen David Adom, which is like the equivalent of the Red Cross, does not go into the Palestinian neighborhoods. So when COVID started, there was no ability to test people in the Palestinian side, right? And then you have a wall separating Palestinians from the testing centers. So Israel literally, did not give them access to COVID testing in the beginning. And when the Palestinian Authority tried to start its own clinic in Jerusalem, Israelis came and demolished it, right? So it really much shows that, they don't want to provide the people of Jerusalem with access to healthcare, and they don't want them to get that healthcare from the PA, even if there's a wall and a checkpoint between you and the testing center, right? And you have, Jerusalem is a very, a heavily militarized area where you can really see the full force of the clash. But I would say the same, like also in the West Bank itself, they have demolished testing centers for COVID. Colonial violence does not pause when there is a pandemic, right?
Yeah, and I think, on top of that, speak to the political economy point that Osama brought up earlier. You have a situation where in the West Bank, there's big problem with unemployment, not as much as in Gaza where young people have 70% unemployed, but huge problem with unemployment. The jobs available, and this sort of speaks to really one of the other tragedies of colonialism, the two main jobs that are available are working in the security apparatus of the PA, right, which is a subcontractor of Israel with regard to security and policing the Palestinian population. And then the other one is really in construction. And so that's constructing settlements that are eliminating and colonizing them, and also construction within Israel within 1948. And you have, you know, tens of thousands of people going across from the West Bank into Israel every day. Many of those people without permit, right? And it's known, right? And if you think about all the rhetoric and all the propaganda from Israel, they know that there's tens of thousands of people who are crossing undocumented, quote unquote, illegally every day, but that this is a source of cheap and easily exploitable labor, right? Because it's off the books. So then you have this situation where people are in desperate need and are living really on the edge in terms of being able to survive, have to go continue that work, right? Israel was having a massive outbreak, and you really had a situation where in the West Bank, people had to choose between putting food on the table, but also putting themselves at risk for COVID, such that they would then potentially bring it back to their families or stay in Israel for extended periods of time, right? In some cases, workers got sick and were literally dumped across the border, across the Green Line, while sick, to get them out of Israel, right, by the authorities. So just to give you also a little bit more sense of how these things all intertwine, right? And then all the challenges that Osama spoke about in terms of actually managing disease. And when you're living in such close quarters, like in the refugee camp, you know, it's really just a tinderbox where you're, you know, we know this is an aerosolizing virus, meaning like it's not just from droplets. You know, if you're spending time together in close quarters, you're going to get infected. And you really set up a disaster. And for now weeks, the West Bank's been having somewhere around 500 cases a day. And we're still haven't probably seen the full effect, given the lag between infection and ICU and death, between what we're going to see. And given how few beds are available in the West Bank and Gaza, you know, and God forbid things get worse in Gaza, where there's only been, you know, 78 or so cases, you're going to have a true disaster where the only treatments that are available, which require being intubated and ventilated, are not going to be, they're not going to be available. Israel's not going to let people cross for that kind of care, and you're going to have a, you know, a case of many people dying otherwise preventable deaths.
Thank you very much for both of your answers. And the last
another thing I would like to add, just a moment, is that we need to remember that you do have some paradoxically protective factor, right? So most of the mortality or the severe cases of COVID are people above the age of 80, right? Age is a huge risk factor. And the Palestinians in general do not live that old, unfortunately, because of the bad health status of overall. So also the Palestinians inside Israel, but definitely Palestinians in the West Bank and Gaza die way sooner. They don't have the privilege of arriving to the age of 80 to die from COVID. They die way before from other preventable diseases such as diabetes and hypertension and other cases. So of course there's a lot of pre-existing condition, and here colonialism is the major pre-existing condition, and we still don't know how much that will affect, but we need that even if we don't see a huge, until now we're not seeing huge amount of people dying from COVID, we need to remember that people do not live enough to die, to reach that age and die in the 80s. And also maybe because there's that kind of segregation from Israel. COVID came in the beginning to wealthy neighborhood, to people that were tourists or businessmen traveling around the world. So in that sense, paradoxically, being geographically segregated and enclaved, at least in the beginning, can a bit protect you. And not having a lot of senior resident houses. So most of the elderly people still live within their families and not in residency, senior residency, which have been centers for the spread of the disease. I mean, even in the future, if we will not see catastrophic numbers, that doesn't mean that the situation is good. It just means that other factors have confounders, right, have made it not explode.
Thank you.
Want,
oh yeah, Ayman, go ahead.
No, I just wanna share about the funding issues. Actually, even COVID-19, like medical issues, and like in Gaza, for instance, like every mile you have 60,000 people living in. Like in my family, just my family, we have at least 25 people like living. So you can imagine how like it is the largest open air jail in the world, and you can imagine how it is crowded, like even in Gaza. Uh, but I just want to share about the funding sources. Like even when it comes to COVID-19, when Trump like halted 350 million to United Nations Relief and Work Agency, and that disrupted actually also the medical hospital run by United Nations Relief and Work Agency. And in the same time, like Israel, as you know, $3.8 billion, like $10 million a day. So you can imagine the disparity, even in terms of funding. And also the second point, which is about the smear campaign. Right now, Israel's Ministry of Strategic Affairs, they are launching the smear campaigns against any civil society organization in Palestine. So even like before COVID, and it is intensified after COVID. So you can see how it is hard even for the civil society in Palestine to function because of the smear campaign running in Europe and the United States, and also lack of funding to them. And this is a major issue actually that really hinders their work on the ground. Yeah, thank you.
Thank you so much for all of your input. And then the last question that we have for today is what kind of long-term health effects do you see forming in the Gazan, or I guess just Palestinian population due to the occupation and maybe even environmental forces such as like lots of smoke and dust in the air, little access to water, lack of farmland, less hygiene capabilities, state-sanctioned violence, etc. And this is open to anyone.
Can you repeat your question again? Sorry.
Yeah, of course. So what kind of long-term health effects do you see forming in the Palestinian population due to the occupation and environmental factors, such as like lots of smoke and dust in the air, little access to water, state-sanctioned violence, factors like that?
I can start. I think like there's eco-apartheid in Palestine, and it is very clear actually when you see the herbicide and the Israeli drones throwing herbicide against the farmers in the restricted area or in the buffer zone between two brackets. So it is very clear, like when we also speaking with our partners, actually, when it comes to agriculture, the herbicide is affecting the area. The use of as you know, in 2014, the use of white phosphorus, it has ripple effects until now in all of the population. Second, if you go to the fishermen, actually right now you cannot swim in the Mediterranean Sea. It is the only place that you can go to the sea to have some recreation in a very strict siege on Gaza. So right now, I ask my brother, why you shouldn't go to the sea, like have some fun? And he said, we can't because there's a sewage, and the sewage is coming from the Israeli aquifer, coming from so like there are a lot of actually pollution coming from this settler colonial project, because as someone of the speakers said, like, they actually, the premise is they are dealing with inhumane. I mean, as there's no humanity in Palestine, and Gaza, as Dr. Tanous said, like it's like experiment for their own like military adventures. So I think Gaza is an experiment, was for a while. I remember it when I spent 25 years in Gaza. I remember it every day when the Israeli soldiers coming from Brooklyn, from Russia, and how to slap your father in the face. I think this is a mental health apartheid. And when they tear gas every day, and there are so many issues. I think your question, we can spend literally a whole about eco-apartheid in Palestine, and also in the West Bank with the apartheid wall that is like ripping the West Bank, and and also the agricultural way, and how they can disrupt the life, especially in the Jordan Valley. As you know, 91% of the spring water comes from the Jordan Valley. 30% that Israel is trying to do with their de jure annexation. that is really de facto since its all inception. And this is like, I just want to mention about the United Nations Relief and Work Agency, and this funding is really lacking in Palestine. And this is like one of my major work actually, in how we really increase our funding to partners who are really saving lives every minute.
Thanks, Simon. That's great. I'll just make two kind of points about long-term effects. One of which is, you know, if you look at populations that have suffered tremendously under settler colonialism around the world, so different indigenous American populations, Aboriginal population, Australia, Canada, right, where settler colonial countries have been particularly successful in their eliminatory projects. You see, you know, diabetes rates that are sometimes 3-4 times higher than the settler population, right? And in Palestine right now, it's about twice as high, right? So I think when you know, Osama connected all those dots for us, and, you know, it can be, you know, a challenge to kind of follow that whole process through, but diabetes is one of the ways that oppression sits in the body, right? And it happens through many different formats, through mental health, through stress, through the political economy, through the availability of foods, through you know, changes in lifestyle and diet, et cetera. But I think that's one of the things you're going to see even more extreme versions of the inequities we're already seeing in Palestinians. The other point I'll make is that you know, in the population that I'm working with in one of the refugee camps, in Ida camp, it's the most tear gas exposed population in the world based on a Berkeley University study that came out a couple years ago. And we don't know what the impacts of that going to be at this point, right? So tear gas and the different chemicals that make up tear gas, it's banned under the Chemical Weapons Convention, right? So you can only use it in domestic situations, right? So the United States uses it all over, you know, for its population, especially people of color who are protesting, right? And then the other of many examples, but the other key one is really in Palestine. And so that, you know, we don't know what the long-term effects of that are yet, right? Because it hasn't really been available to study for many, many decades. But, you know, this is what happens, right, when you have this surplus population or disposable population you have in necropolitics, is that you know, there's basically experimental, you know, real life experimental violence, both structural and direct violence that are being, you know, done, and we don't totally know the health impacts yet.
Thank you very much. Dr. Tanous, do you have anything to add before we move on to questions?
Yes. So, you know, a lot of times we, especially in the context of Ghazi, we often hear that, you know, after 2020, Gaza will be unlivable. After this amount of, you know, 90% of the water will be undrinkable, all that amount of food security and so on. And then we forget that in the middle of all of this, you know, life in Gaza as it is now, or since day one of the occupation, has been unlivable, right? And in the West Bank, the same, I would say. We have this image of what does a medical catastrophe look like, right? And we expect a kind of something spectacular, or exposure, expulsion, right? Or like people dying in the street because of that. But people die, you know, slowly from a lot of reasons that we don't understand, and prematurely. And we always need to remember that, you know, when there is no data, there's no problems. So Palestine is not the US. You don't have these 200 universities with the public health faculties who are researching every little thing. And, you know, imagine if we had the Ferguson without people researching the lead poisoning, or in other places, the toxins that the Black community has been exposed to. So I think this is very much the case in the West Bank or in Gaza. You don't have this amount of laboratories who can sit there and truly analyze, you know, waters and their and food and their effect on the population and so on. What we do see is a terrifying shortening of life and death from preventable causes and preventable diseases, and basically also a life that is unlivable, right? What kind of life is livable if you have, if you are trapped since day one and you cannot even plan? You know, one of the most shocking things to me in Gaza was this feeling of, you know, we all have our plans for the future, for the next year and the upcoming year to study and then to relocate or to do this and that. And if you live in Gaza, you simply can't do that. You really don't know what will be bombed. You can't, you know, you can only dream about getting a scholarship. You know, very few people do that and can exit Gaza. But at the end of the day, it's simply living in a prison that is unlivable. So we don't need to think about the future, what it will hold for us. The present in itself, as it is quite catastrophic, and we should work immediately to reverse that, to see the present as an unlivable place and unlivable reality. In the medical sphere, of course, what everyone has talked about, but also the pollution of the water, the quality of food. Already now in Gaza, you have, I think, around 40% of children have iron deficiency anemia, you know, such treatable disease and preventable diseases, and many different malnutritions and so on. So we will see the consequences of that, but always need to remember that there isn't a lot of research on what is happening on the ground.
I just want to corroborate what Dr. Tanous said, like from my personal story, like about lack of planning. Like usually you put daily plan or like your strategic plan or your action plan for the week. In Gaza, you cannot think about the future, like about the planning. And this is part of mental health, hopeless, helpless situation. And I think it is part of a slow motion genocide. And I believe it is genocide according to the United Nations Convention on the Definition of Genocide in 1948. And in the West Bank, in Gaza, fast motion genocide. In the West Bank, it is slow motion genocide. Just a story, I spent 7 years away from my kids, living in the United States, working on my PhD, working on my mental health and studies. 7 years, they couldn't go out of Gaza. 7 years. 7 years. Imagine, like 7 years that I'm trying to reunite with them for 7 years. They came the last year after like too much, after agonizing, arduous, strenuous, whatever you can put any adjective here to describe the situation. So this is not me. Actually, you are dealing with the high percentage of education and brilliant folks in Gaza. 80% of the income goes to education. And you see they are trapped inside Gaza. That's why you can see like a PhD holder, he's driving a taxi. I mean, to be honest, all respect to all professions, but you can see the disparity even in thinking and looking for a future. Just I want to make sure like I can corroborate like Dr. Tanous about food security, the lack of food security, 75%, and all of that. There are so many issues actually that Gaza is became an experiment for. Thank you, Dr. Tanous, for mentioning that.
Thank you so much again to all of the speakers, and thank you for your time and educating us on this very, very important topic. We have one last question, but before we ask that, because we're already out of time, I'm going to open it up to any audience questions that anyone might have. You can also put them in the chat if that's easier for anyone who wants to ask any questions. Okay, so I guess we'll just move on to our last question, which is basically in light of all of this information. Oh, Veronica had sent one earlier. Let me read that one out loud. Oh,
yes.
Veronica had asked, what can you tell us about Palestinian hunger strikes, specifically in Israeli prisons? Do Palestinian hunger strikes have access to proper health treatment? Strikers have access to proper health treatment? Are they subject to violent force feeding as an Israeli tactic to stop their protest?
So, no, they do not have access to proper health treatment. The doctors who work inside the Israeli prison are not a part of the IMA, the Israeli Medical Association. So also their ethical code is different, and actually they're not bound. So no, prisoners do not get the appropriate healthcare that they deserve or need, and a lot of times this is used a bit to pressure them. But luckily, forced feeding until now has not happened. The Israeli Medical Association issued a strong stand against force feeding, and a lot of times these prisoners are moved into hunger strikes become from a political issue into a medicalized issue, and then are moved outside to a hospital and threatened by force feeding. But still, it happened once in the 80s, I think, when one was killed. He died because the nasogastric tube entered his lungs, and he had an aspiration pneumonia and died. So until recently, there has been no cases of force feeding, luckily, but still that doesn't mean they are treated horribly and have been fragmented completely as the prisoners movement in general.
Thank you. And I had a question about specifically the Israeli Defense Forces in occupied territory and the Israeli police. And I was basically wondering, like, how do those two forces affect day-to-day Palestinian life? Because we briefly touched on them when we were talking about mental health a little bit, but specifically in the instance of Iyad Halak, who was murdered, and then also Ahmed Erekat, who was killed at like the border patrol stop on the way to his sister's wedding. I was because a very jarring event. I was wondering, like, how do those two forces play a role in Palestinians' day-to-day lives?
Yeah, I think, I mean, in addition to those kind of those high-profile murders, you know, there's really the almost daily, at times, certainly weekly, night raids that happen in refugee camps. So in areas that are particularly, you know, likely to have sort of resistance efforts, you know, as all, you know, colonial regimes have done, you know, they control population with various tactics, and one is sort of night raids in refugee camps. And so the apartment that I stay in has been raided in the middle of the night before. It's usually between, you know, 4 a.m. this time period, and it's a way, and oftentimes arresting family members, destroying property, terrorizing the family, arresting children, you know, detaining children as young as, you know, 10, 11, 12 years old. And it's a way to basically create sort of, you know, state terror to control. So this, from a mental health perspective, as you can imagine, I'm sure Ayman can talk about, is devastating, has intense consequences. From our focus groups, you know, we had quotes come out of things like, where one woman said, you know, when my daughter came home from prison, you know, she couldn't, you know, talk to anyone for 5 days, or, you know, my son hasn't slept, you know, in the last week since his brother was, you know, kidnapped in the middle of the night. So just like, you know, in addition to the murders from the occupation forces, you're talking about this kind of, like you said, day-to-day levels of violence that are just devastating to human flourishing in life.
I just want to say, like, about the prison. Actually, since 1967, 221 prisoners died in the Israeli jails, including actually 73 of them, they were died because of torture. And this is very important to know about the history of the Israeli torture and the administrative detention. The second one, I think about mental health, like back in 2001, actually, there was a girl, like, she was four months old. She died with a missile inside her back. She is 4 months. And this is Mona al-Hijju. It was in my hometown, Deir al-Balah, Dr. Tanous, Deir al-Balah refugee camp. And Mona al-Hijju died in that time. So why I'm talking about that? Because I mean, literally, like Israel doesn't differentiate between a child or not. Israel were attacking United Nations, like where schools where they are double shifted. So there are too many kids. Like in the last one, actually 521 children died, like in 2014. So you can see the lack of the indiscriminate killing and murder without compunction or like contrite or remorse when it comes to children. So this is like, I mean, also if you ask most of the kids, when you ask them, they have a night terror. Usually they have urinary involuntary urination, and also sometimes you have over jealousy. I mean, also like thinking, I mean, walking, just very simple, walking in Gaza is traumatizing because you will see a demolished house. You will see the drones are hovering every minute. Ooh, all of the night, so they cannot sleep. I remember when I was speaking with my daughter, and I literally can hear the explosions. I literally can hear the explosion, and how come they can survive. I just want to finish my very important one. I think in Palestine also, either that we are under a traumatized situation, agonizing one, but there's a sense of community belonging. There is a sense of moral superiority when it comes to Palestine cause. When you ask some people why you are still fighting for something that it looks like it is as Alice in the Wonderland. Some people ask me like that. I think there is a sense of moral superiority. There is a sense of that is a cause. Yeah, you have no military power. Yes, you don't have economic power. Yes, you don't have a US funding or imperial funding, but you think you have that deep sense inside yourself that this is your land, this is your indigenous land, and this is the moral superiority that it makes people going on and on and on in their fight for self-determination. So yeah, I will finish with that. Thank you, guys.
Thank you very, very much for your responses. And if you guys have time to answer one last question, we're way over time. But this was just from the curiosity of the people who organized it. But we were wondering for the audience, like, what do you guys suggest as ways for people who are living in the United States or outside of Palestine to productively assist the whole situation? Yeah, so like any resources or organizations that you think are that are good to donate to or to keep and then another person asked about like how to stay up to date about everything that's happening in Palestine as well.
There's a number of good sources now of news that have been posted in the chat there. I'll say that, you know, for those of us who are American citizens, I mean, we're just as complicit in what's happening in Palestine as Israelis. You know, if you think about all the support that the U.S. has given and all that they've shielded, you know, and continue to shield and sort of to block what's necessary to actually hold Israel accountable for all these crimes. So I think, you know, whatever we can to continue to change the nature of the debate here, and there are a lot of reasons to be optimistic. Certainly the primaries in the last few weeks, Democratic have seen again a lot of super pro-Israel congressmen go down to people who are in some cases pro-BDS. So there's a lot happening. So being politically engaged in the US is key. You know, and I think supporting certainly like grassroots efforts, you know, like the project I'm involved with, Help for Palestine, certainly the Gaza Community Mental Health Foundation does incredible, you know, work that's so important. If you have the financial means, and, you know, I think, you know, doing this kind of work and educating yourself and others, like this is what's going to change the game, so we can move that needle to the point where people recognize this exactly for what it is, which is, colonial and settler colonial situation that looks more familiar to the 19th century, but it's occurring right now as we speak. And that's how it's going to be remembered. And so, you know, my feeling is like, I need to do it now that I know what the situation is and I've seen it with my own eyes and studied it. And I need to do everything I can think of to creatively bring this situation to an end. That's what I would say. as a co-conspirator, non-affected group.
I like the term co-conspirator. I have to check the terms and its connotation and denotation, but I like the idea, the meaning, what you mean by it. I mean, white supremacy, they will attack us because of this word, but yeah, that's a great one.
Okay, all right. I think with that, we will end this event. Again, thank you so much, Dr. Wispelwey, Dr. Tanous, and Mr. Njim. We really appreciate your time and your participation in this panel. It's been so valuable, I know, to me, and I'm sure the audience members as well. And thank you to everybody who attended. There have been a lot of resources that were posted in the chat from the speakers as well as some audience members. So if everybody could, before you leave, put your email address in the chat. So we will be sending a follow-up email with all the links that were posted in case you didn't get them. And then we will also be sending this recording out. We recorded the majority of the event as well. So we will keep everyone updated with that video as well. So again, thank you so much. We really appreciate your time. And then I will stay on the call just to like collect email addresses and stuff. And if you guys want to, you can stay on the call if anyone has any other like lingering questions they want to ask. But yeah.
Everyone, thank you so much for organizing, and special shout out to Osama. It says it's about 3 in the morning, I think, in Palestine right now.
Yeah. Hats off.
Thank you. Yeah, it is. Thank you for organizing. It's always a pleasure to speak to enthusiastic, U.S. students. I think, it's really important to keep that in mind. Just like I think in the 60s and the 70s, Vietnam was the defining issues. Like, are you with or against the war on Vietnam? Are you with or against the French colonization of Algeria? Or do you stand with or against apartheid South Africa? Today's issue is like Palestine is the last settler colonial ongoing military occupation, and it has been so way more neglected than it should be, and the limits of discussions on Palestine and even like the decency, right, where Palestinians are just seen as obstacles to Israel national security at top, right, like rather completely subhuman. It's really devastating how such a discourse can continue. So I think the role of people like you, of young students, to really center that into the issue of, yes, there is no human right to dominate. No one has the right to create a sovereignty over another people and to occupy them. That should not exist, and that should not be supported, right, and so on. And the whole discourse should shift radically into an approach also from a term of global health, but also from justice, right? From global justice and from global health, that settler colonialism is bad for health. And the only way to rectify that kind of justice is to decolonize the US, but also Israel, Palestine. And we can hope that, you can work towards a more progressive discussion in campuses and also outside of campuses and in the general political sphere.
Yeah, thank you so much.
Thank you.
Yeah, that's just the struggle right now, is like changing the rhetoric that people use when talking about the conflict. It's always vilifying Palestinians and never actually taking an objective approach to the conflict, especially on college campuses. I know Northeast is very, very guilty of doing this, which is why I felt it was really important to organize this event. Northeastern does not have a good history when it comes to this.
It's not even a conflict, right? So it's not a conflict. Implies that there are two sides that are fighting over borders. No, like occupation, right? It's colonization.
Right.
It's not a conflict, right?
Yeah.
So again, and thank you, Bram, and thank you, Ayman, and thank you, the organizers. Had the pleasure.
Yeah, thank you.
Yeah, just to reiterate what Ramya said, thank you so much. We really appreciate you guys taking out the time to speak with us.
Sure, you're most welcome.
Thank you, guys.
It's really an honor. And anytime. Thank you.
Bye-bye.
Bye.
Bye.
Bye-bye.
Salam.
Is it just us? Okay. I'm gonna try to copy and we can't copy and paste email addresses.
We have
Can
to stop the recording though.
Oh, yep.